I'm going to show you how to draw up your Lubion injection. This is your progesterone support and you will be advised when to start it. Inside each box are 7 vials. These are pre-made fluid vials. You need 1 for each dose. You should have also been supplied with your syringes and your needles and a sharps box. There's 2 different sizes of needles. Take the larger needle first, which is usually red, and attach it onto your syringe. Flick the cap off of your Lubion vial, which can go straight in the bin, and then you need to pierce the rubber bung with your needle and draw up all of the fluid that's inside. This can now go into your sharps box. Your large needle can go into your sharps box, and now you need your smaller needle, which is your needle for giving the medication. There may be some air in the top of that syringe, so very slowly push the air out so that the fluid is at the top. The injection is going to go into your lower stomach, anywhere between your knicker line and your belly button. Take off the cap of your needle. It's a very small needle, which you inject at a 90-degree angle into your lower tummy. Very slowly plunge that injection into your lower tummy. Hold it there just for a couple of seconds and then withdraw. The needle can now safely go into your sharps box and your syringe can go into your ordinary waste bin.